Dr. Vijay Limaye is an environmental health specialist working as a climate change and health science fellow at the Natural Resources Defense Council in New York City. He's broadly interested in quantifying, communicating, and mitigating the health risks associated with climate change, with a focus on the public health burden of global air pollution and extreme heat events. Prior to his role at NRDC, Vijay worked for 3 years as a scientist at the U.S. EPA regional offices in San Francisco and Chicago, focusing on issues such as Clean Air Act regulatory implementation, risk communication, citizen science, and air quality monitoring policy. Vijay holds a BA from the University of California, Berkeley, and a PhD in environmental epidemiology from the University of Wisconsin-Madison. For his dissertation, Vijay has conducted interdisciplinary research quantifying the health impacts of climate change-triggered air pollution and heat waves for populations in the United States and India. We're so pleased to have you here at the Alliance of Nurses for a Healthy Environment and look forward to your presentation. Thank you.
Thanks a lot. Thank you, Jessica, and thank you all for attending and making time from what I sure are very busy schedules for this. I will dive right in. As Jessica said, I'm Vijay Limaye. I'm now at the Natural Resources Defense Council working broadly on climate change and health topics with a focus on air pollution and heat waves at NRDC, but I do have quite a bit of experience in government at EPA. And I know they've been in the news a lot lately on this topic, so I'm happy to chat about that towards the end of the presentation. But for today, I want to focus on this broad topic of climate change, air pollution, and our health, and delve into some of the research that I've been able to participate in at the University of Wisconsin-Madison, really with a whole team of interdisciplinary researchers. I'll just start right off. The scene depicted here of a kind of hazy New York skyline really draws attention to air pollution as an issue that's really important for the environment and public health. Globally, air pollution is by far the most dominant environmental risk factor for disease and early death, rivaling poor physical activity and poor diet as it compared to ill health. The best available global evidence suggests that more than 6 million premature deaths each year can be directly attributed to air pollution exposures, and that encompasses both outdoor or ambient air pollution and indoor air pollution. Here in the US, we know that about 25 million Americans, and I'm sure you all know this very well, are living with asthma, which is a condition that is, of course, exacerbated by air pollution. And, although we've made a lot of progress over the last 5 decades in cleaning up our air, there's still a lot of work to do. From a health standpoint, the most important pollution sort of components that we'll talk about today are called PM2.5, small, fine particulate matter, and ozone. So this presentation is just going to focus on those two air pollutants, but we can get into a broader discussion of other pollutants and how they connect to this issue towards the end. So I'll advance to the next slide here and really delve into some more on the methods of this particular study. So one kind of main point I want to drive home from this presentation today is that air pollution and climate change are connected in pretty complex ways, actually. Oftentimes, the sort of public discussion is about the contribution of a specific air pollutant like carbon dioxide to accelerating and contributing to global climate change, and that's certainly the case. But we also know that a change in climate will have, in turn, an effect on air pollution concentrations around the world. Although there's been a lot less research on that particular topic, in part because of the complexity of modeling air pollution currently, and in part because of the sort of interdisciplinary toolkit that's needed in order to answer such a, what seems like a pretty simple question. So the overarching question of this particular study is trying to examine how climate change will affect air pollution concentrations and public health in the eastern United States. And that's sort of the broad sort of approach that we're taking, and I'll walk through the methods of how we attempt to answer that using this interdisciplinary toolbox. So just as a bit of background, I'm guessing you all, since you're interested in this topic, have seen slides like this before, so I won't dwell on them too long, but I do want to sort of provide just a brief overview of the two pollutants that we're most concerned about in terms of public health. So the first is particulate matter, or what's commonly referred to as soot. This is the only pollutant in the United States that's regulated by size rather than chemical composition. And that's because particulate matter is a complex mixture of particles, condensed liquid droplets, and basically a complex mix of components that are derived from the combustion of fossil fuels. And the really sort of key harm that's derived from PM is its size. So this figure depicts in that large black circle the sort of strand of a human hair is roughly 70 microns in diameter. And these particles that we're concerned about are orders of magnitude smaller. And it's the size of these particles that makes them especially damaging from a health perspective. The smaller they are, the deeper they're, of course, able to penetrate into the respiratory tract and actually enter the bloodstream and trigger an inflammatory response within the body. And so it's really by far the most important air pollutant from a public health perspective. And we're really at the cutting edge of the science and being able to really dissect the specific chemical components of PM 2.5, including acids, organic chemicals, metals, other dust particles that comprise this sort of umbrella term of PM 2.5. It's important to note that particulate matter is both, emitted directly when we burn fossil fuels, like coal, for example, but can also form secondarily in the atmosphere through chemical reactions. So it's a complex problem to model because it's not just something that's, emitted from a tailpipe and that's sort of the end of the story. It's a complex story to include within the entire sort of climate change scenario. I just do also want to say that PM 2.5 is relatively weakly correlated with weather variables, meteorological conditions, which adds sort of another layer of complexity to incorporating this pollutant within climate change and health analyses. But the modeling that does exist suggests that reduced precipitation patterns and an increasing frequency of stagnant air masses could result in worse PM pollution globally into the future. So it's definitely an area of ongoing research and concern within the sort of environmental air quality modeling community. The second pollutant that I want to really focus on today is ozone or smog, which I'm guessing a lot of you have heard a lot about before. So I won't delve too far into this, but ozone or smog, in contrast to PM 2.5, is only a secondary pollutant. So it's not emitted directly from a tailpipe or a smokestack, but rather forms only in the atmosphere. And as a result, the formation of ozone is deeply dependent on environmental conditions. And so climate change could play a potentially pivotal role in determining the concentration of ozone that we see around the world in the future. So ozone is composed of basically these building blocks of nitrogen oxides, which are, again, byproduct volatile organic compounds, or VOCs, which are both sort of human emitted and emitted from natural sources. They're what are called biogenic sources. Certain tree species and other plant species emit volatile organic compounds, and those actually play a role in part of the ambient air pollution problem in terms of ozone. Ozone is a lung irritant and associated with a broad range of health risks, including hospital admissions for asthma attacks and other respiratory symptoms, impaired lung development, and premature mortality. I'm remembering now I didn't really delve into the health impacts of PM 2.5, but they are honestly a staggering list. PM 2.5 is associated with premature mortality very strongly, along with heart disease, lung cancer, stroke, asthma exacerbations, and other cardiorespiratory ailments. So it's really these two pollutants are on the top of our list in terms of concern from a public health perspective. So because of the chemical relationship that underlines ozone formation, you'll see that I've highlighted sunlight here. This pollutant peaks commonly in the summer, in midday, and we know that higher temperatures stimulate the chemical formation of ozone in the air that we breathe. So that's why when we think about climate change and look into the future and consider, in general, warmer weather across the United States, for example, we're concerned about the ozone problem getting worse. We may see no underlying increase in the amount of nitrogen oxides or volatile organic compounds in the air we breathe, but increasing temperatures could result in higher ozone concentrations, especially. One other point I want to make about ozone in contrast to PM 2.5 is that it has a longer residence time in the atmosphere. So it ranges from a few days to a few weeks. And so ozone is basically able to drift further and cause adverse health outcomes over a broader geographic range than PM2.5 would. So in terms of just the climate change piece, I mentioned the temperature relationship for ozone and what we're expecting there. But we're also concerned that the biogenic hydrocarbons, the VOCs that are emitted from plants, that we may actually see more of those coming from plants due to warmer weather. There's research that plants actually respond to higher temperatures and emit more VOCs. So we're concerned that, again, even without any changes in underlying emissions, we might see more ozone into the future. And so this study is really an attempt to analyze PM2.5 and ozone concentrations in a health context into the future. Yeah, that was a lot. Hopefully I'm at a good pace, but if anyone wants you to slow down, just let me know. I'm happy to. So now I'm really getting into the basics of our study. And I mentioned looking at the Eastern United States and climate change impacts. So this circle here over the map really highlights in general the study population that we were interested in. And we set 2050 as sort of a policy and modeling relevant time horizon. We, are concerned about air quality impacts, obviously before that and after that, but this represented sort of an attainable time horizon in terms of our underlying analysis. So we chose this region for a number of reasons. It currently confronts a range of air pollution problems, and by far the areas that exceed EPA's air quality standards for PM2.5 and ozone commonly fall within this region or in California. Moreover, this region includes a number of our nation's most densely populated cities, and by the middle of the century is estimated to encompass about 240 million people, with almost 50 million of them over the age of 65, and especially vulnerable to air pollution exposures. So that's the geographic range and the time horizon. And this next slide will really walk through the sort of modeling recipe that we conducted in order to try to answer that question about what climate change means for air pollution and public health into the future. So this is our general modeling approach. It's 4 steps. And basically, we start with assessment of what climate change could look like in the United States and a baseline year upon which to compare changes in air quality and health outcomes. We use that climate change scenario to drive a climate model, which in turn drives an air pollution model, and then finally a health impact model. So it's really a unique opportunity to pair up these models in ways that frankly have not been done before, and to try to get at that question of how climate, air quality, and health are interrelated. So one challenge in the area of air pollution epidemiology when it comes to climate is really getting all of these models to talk to each other. Oftentimes they live in separate silos and aren't really constructed in ways that allow them to exchange information readily. And so this study, aside from the main research aim, was also sort of a proof in concept pilot test to see if we could get these models to basically play nicely together. So I'll start just sort of walking through a couple of the details in terms of how we step through our analysis. And first, we start with an understanding and a sort of projection of what climate change looks like in the United States into the future. Here, we rely on a program called NARCAP, the North American Regional Climate Change Assessment Program, which is run out of the Center for Atmospheric Research in Boulder, Colorado. And so this graph here basically highlights various emissions scenarios that are published by the UN Intergovernmental Panel on Climate Change. So you can see that black line represents temperature trends over a century between 1900 and the year 2000. And where that black line changes to different colors, those are different sort of emissions potential trends in terms of what global warming looks like into the future. So you can see we range from a relatively modest increase in temperature in the sort of yellow-orange line all the way up to a pretty steep increase in global average temperature by the year 2100. That red line represents what's called a business as usual emission scenario, in which we basically continue on the path that we've been on for the last century or so and anticipate substantial global temperature change by the end of the century. So you can see here by the year 2100, the global average increase in temperature relative to a long-term average is somewhere between 3 and 4 degrees centigrade. And remember that that's an average. So there's going to be areas that actually experience more extreme temperature swings than that. Unfortunately, given where global environmental policy is at, we're actually, most closely mirroring that red line right now, and what's called the A2 scenario. And so we chose that scenario just as a first step in trying to build our recipe of what climate change could look like in the year 2050. So there are, certainly decisions that we made throughout this research in trying to envision the future, and that was certainly one of them. So we ran that climate change scenario through a climate model representing the eastern United States. And so this histogram here depicts changes in temperature that result from application of that climate scenario. So the blue bars represent our baseline year, sort of our underlying baseline assessment of temperature across the eastern US, and the frequency of those temperature readings across the study region. The red bars, in turn, represent what our climate model indicates temperatures will look like in the year 2050 across the eastern United States. And so you can see basically here a dramatic shift. Sorry, that arrow is sort of covering it up a little bit, but you basically see more than an 8-degree Fahrenheit increase in the average minimum temperature across the eastern United States by the middle of the century. So this represents, pretty substantial temperature increase. It is in line with some climate modeling, although we did see other options in terms of the climate scenario that produce somewhat cooler results. So we focused on this warm scenario as a first way of demonstrating sort of the potential ceiling of temperature and ozone effects, especially. So I'll move on from this temperature result to get into some more of the air quality analysis. And so I mentioned earlier that we have kind of a baseline year of analysis upon which to compare changes in air quality and public health into the future. So this map here represents sort of our base case of ozone pollution across the study region. So here you can see any colored areas where we had modeling data to represent the eastern United States. You can see that it actually extends, pretty far west, past Minnesota, Iowa, etc. And you see ozone concentrations here highlighted. And you can see again that certain areas of the eastern US already struggle present day with a lot of ozone air pollution problems. And I'll mention here that this air quality analysis is restricted to the summer months, so June, July, and August, when we know that ozone pollution is the worst. So when we compared this baseline map to what a mid-century estimate of ozone pollution looks like, just fast forward here, we end up with really a kind of jarring picture about future air pollution. We see more than a 15 part per billion increase in the 8-hour maximum average ozone concentration. And you can see it from the map here, right? There are certain areas that light up in terms of hotspots, and especially in and around cities on the eastern seaboard, substantial increases in ozone population. Ozone concentration, sorry. We know that the current national ozone is 70 parts per billion, so this 15 parts per billion increase represents about a 20% increase relative to the standard. So this, is a significant result in terms of potential changes in ozone concentrations just due to temperature alone. So we held human emissions constant and basically fed just the temperature change and meteorological change through the model to understand how ozone could respond. And it's a pretty significant change from the baseline year. Now I'll show the results for PM 2.5, which are much the same story. So here again is the present day map of PM 2.5 pollution. Right now, about 18 million Americans live in areas that exceed the national standard of 12 micrograms per cubic meter. And we can fast forward into the future. And again, it's a significant increase. When we feed in our climate results, we end up with a new estimate of PM 2.5 concentrations across the region. By 2050, concentrations increased by about 3.8 micrograms per cubic meter, which represents, again, roughly about 30% of the current standard. Again, with the highest levels in eastern Ohio and over the East Coast. So here, huge swaths of the country are thrown into non-attainment for the PM 2.5 standard. I will mention here that, again, there's a lot less certainty about how PM 2.5 responds to climate change, but this represents potentially serious impacts just given no changes in human emissions, but the effect of climate alone. So these air pollution results on their own are, pretty serious, and we're interested in what that means for public health, right? Because we need to know where people are living across the region, what their underlying health characteristics are, and what the changes in exposure might be in order to understand changes in health. So this next figure really draws attention to the modeling tool that we deployed in order to conduct our health impact assessment. So the model that we used is called BenMap. It's the Benefits Mapping and Analysis Program, which is actually an open source model that is freely distributed by the U.S. Environmental Protection Agency, commonly used in EPA's regulatory impact analyses for things like the Clean Power Plan and the standard setting process for the National Ambient Air Quality Standards. And it's a tool that basically is powerful in its integration of both environmental, demographic, and health data. So this figure here depicts the various ingredients involved in the BenMap model. We start all the way over on the left with an estimate of air pollution, like the maps I just showed, along with a population estimate of where people are expected to live around the country by the middle of the century. We include baseline disease and mortality rates that are based on projections from the Centers for Disease Control and Prevention. And that information is all married with exposure response functions that are based on the cause-effect relationship between air pollution exposures and relative risks for various health outcomes. Another sort of powerful aspect of the BenMap tool is the ability to convert health impact estimates, like the number of premature deaths expected from higher air pollution exposure, for example, into estimated health impacts and costs. So we can understand, based on the value of a statistical life estimate from EPA, for example, what the cost to society is from air pollution health-related outcomes. So this BenMap tool is really a powerful way to combine environmental and human health data in a way to understand what the ultimate impact on public health is from changing air pollution exposures into the future. So using that BenMap approach, we can basically understand broader patterns of health across the region in the future due to changes in PM 2.5 and ozone. Our results from 2,000 excess annual deaths from increased pollution in the year 2050 compared to the year 2007. For context, this represents roughly a doubling of the annual air pollution-related burden of disease in the country in terms of premature mortality. So that's substantial. In addition, on the morbidity side, we found significant increases in the number of asthma attacks, more than 300,000, heart disease incidents, more than 20,000, and ER visits and hospital admissions for respiratory problems. So collectively, this represents significant health just from the effects of climate alone, no changes in human emissions. When we run those health results through our economic impact assessment model component of BenMap, we arrive with a cost estimate of more than $480 billion, which in reality is probably a conservative estimate because it's only the effects of climate alone. So we hear a lot in the climate debate about the costs of switching our energy system from a polluting fossil fuel-based system to one that relies on cleaner renewable energy resources. We hear a lot less about the costs health-wise that would be avoided by mitigating climate change. And so this study and others like it that really draw the link between health impacts and economic impacts really have a place to land in the discussion and help to counter a lot of the resistance that we hear from the fossil fuel side in terms of the cost of a cleaner energy future. So on that note, I just do want to sort of talk about this study in the context of the larger co-benefits discussion. One of the main aspects of the Clean Power Plan, for example, from EPA, is an air quality benefit. So there is this notion that by addressing the same pollution that causes and accelerates climate change, like CO2, we can actually mitigate in the short term air quality problems that are already causing a substantial burden on our health and our economic viability, really. So this figure here really draws attention to the various co-benefits that can be achieved by a shift to cleaner energy. We can enhance air quality in the near term and achieve improvements in public health, deliver cost savings to people who spend money on these adverse health outcomes, and in the same respect, mitigate climate change. So while our results, are pretty, I guess, serious, they also represent sort of this opportunity we have here to motivate change in the way that we do business and the energy that we rely on, and to think more comprehensively about the external effects of our fossil fuel use on our health and well-being currently. Just to delve a little bit further on some of this work, I wanted to discuss the air quality standards with respect to the regulatory picture, just because this stuff in particular has been in the news a lot this week. So EPA regulates these two pollutants that we talked about in the research, PM2.5 and ozone, but also other pollutants. And you can see here a table that really details the air quality standards that are part of the Clean Air Act regulatory framework. The point I want to make here is that climate change could throw this whole system into real disarray. This map figure here shows sort of the degree to which we've made substantial progress in cleaning up our air, even just since 1990. So any line here that's below that sort of 0% threshold on the left represents a pollutant that's well within attainment. So it's below the national health-based standard. As you can see here, ozone remains a problem. We are really skirting the 0% line. A lot of counties are out of attainment for that pollutant. And for PM2.5, the situation is better, but we're still pretty close to the line in terms of protecting health. So when we think about the progress we made, we need to think about the risk of climate change into the future. We created a map just showing, for example, the impacts of future pollution on non-attainment. And so what you can see from this map is that any county that's highlighted in green, in blue, would be exceeding the current national standard for ozone. Any county that's highlighted in yellow or gold is out of attainment for PM2.5. And any county highlighted in green is out of attainment in the year 2050 for both pollutants. This represents a sea change in the regulatory outlook and the impact on states. I mean, we do not currently have nearly as many counties out of attainment for any of these pollutants right now. And this really would represent chaos in some sense at the state level in terms of trying to achieve air quality that's clean enough and healthy enough for state residents. So we have substantial challenge before us in terms of setting air pollution below a level that we already know causes adverse health impacts. Along those lines, I want to draw attention to another arm of this study that we're just wrapping up. So you'll notice on this last map that a lot of the counties that are out of attainment in the future potentially are in the sort of eastern part of the country, and that's not coincidentally part of the country that relies on coal to provide a lot of its electricity. So this map here, you might not be able to see the United States outline there, but the red circles here basically represent power generation from coal-fired power plants. So the larger the circle, the more coal that's being burned in a particular area. And so we know that the eastern US is more reliant than other parts of the country on coal for its power. And as a result, there's a significant risk that climate change itself could further reduce air quality in the area. And that's just due to the power, actually, of air conditioning. So our question in this other research arm that we're just kind of wrapping up now is, how do warmer temperatures stimulate air conditioning and electricity demand? And what does that increased demand from coal-fired power plants mean for ozone and PM2.5 pollution? And so we're just kind of wrapping up the quantitative results on that. But what we're seeing now is somewhere around a 5% increase in air pollution levels due to this sort of energy system feedback, something that's been hinted at a lot in the literature up to now, but never really quantified. So here is some of that work in terms of the electricity consumption side. So you can see we've modeled a different year here for different reasons I'll get into later. Basically, the increase in electricity demand is about 16% in the future due to increased cooling loads from people firing up their air conditioners when it's hotter outside. So I think maybe I've wrapped up a little bit early, but I do want to acknowledge the research team involved. This was definitely a team effort. Jonathan Patz especially is a mentor of mine at the University of Wisconsin, and there's a whole interdisciplinary team, especially on the air quality and energy modeling side, that helped get us to this place. The work itself was funded by the National Institutes of Environmental Health Sciences and the National Planet Science Foundation. And hopefully I haven't run through things too quickly, but I think we've got a bunch of questions. So hopefully I can clarify things to that extent. Thank you, everybody.
Vijay, thank you so much. That was an excellent presentation. The first question is from Barb. Barb, thank you. The question is regards to the disease data, particularly the slide after the bend map that you had shown. With those bend map calculations, what kind of disease data is being used in that model?
Yeah, so BenMap, I'll just pull up that sort of schematic. So BenMap relies on those baseline disease and mortality rates through the Healthcare Cost Utilization Project. And basically, there are both mortality rate estimates that are estimated at the county level on a decadal basis. So 2020, 30, 40, 50, all the way, I think, to 2060 in BenMap currently. And then each of the morbidity impacts, for example, asthma exacerbations or emergency department visits, those are also based on projections paired with population from HCUP. So this is oftentimes a question mark in terms of differences state by state in the quality and quantity of data available. So in cases in which the sort of county level data isn't available through HCUP, we've applied sort of state level averages. So I can get into more of those details. Honestly, I'm a little bit rusty on the HCUP specifics, but that's at least a start.
Thank you. This next question is from Azita. She's asking, what is the fate of particulate matter and ozone in the atmosphere? Can you comment on how they break down?
Sure. So PM has a shorter atmospheric lifetime than ozone. So PM basically is removed from our atmosphere either through what's called gravimetric deposition, or basically the effects of gravity in sort of, these bigger particles tend to fall faster than the smaller ones, but then also precipitation for PM is the primary means of breakdown. So when we have, rain, for example, will result in a clearing of PM 2.5 pollution. Ozone, in contrast, has a much slower sort of degradation breakdown process in the atmosphere. The chemical sort of formation of ozone takes place once these VOCs and NOx emissions combine in the atmosphere. But the hydroxyl sort of radicals, so other air components, act more slowly. So that's why ozone is able to basically travel further and be inhaled by more people than PM 2.5, because the atmospheric lifetime of it is on the order of days or weeks, rather than for PM, which is on the order of hours.
Thank you. On the map of the Northeast United States, what impressed me was if you took a map of the Marcellus Shale, how similar the boundaries to that were of the areas where there was projected increase of particulates and ozone. Can you comment about some of the geographic or the rationale or patterns as to why we think some of those counties will have both increases in particulate and ozone as opposed to others?
Sure, that's a great question. One of the this was surprising to us too, actually, the degree to which air pollution concentrations increased in the future due to no change in human emissions, but just due to sort of the temperature/meteorologic change. The culprit here, we think, is biogenic emissions, actually. So the response of natural ecosystems to warmer temperatures seems to trigger elevated emissions of VOCs. So we have basically more of these building blocks for ozone in the environment through no change in human activity, but just due to temperature change alone, basically. And the concentration of the types of plant species that emit VOCs, unfortunately, are in these same areas. So that's why you see sort of similar patterns overall in PM 2.5 and summer ozone into the future, we think, because secondary PM 2.5, so the PM 2.5 that's formed in the air, is heavily reliant on these VOCs as well. So the same sort of culprit that's involved in PM 2.5 and ozone concentrations is this biogenic component. I will say that there is, a lot of research happening right now into the biological response and how we model that and include it in modeling like this. So it remains an active area of research, but this sort of signals the seriousness of the problem potentially, and potentially part of the problem that we may not have as much of a handle on as we think we do, right? I mean, reducing our reliance on coal-fired electricity is one thing, but managing emissions from natural ecosystems is something, frankly, we haven't confronted. So this really signals the complexity of the air pollution health nexus.
So many of our affiliates are direct care providers. And if I'm a nurse in one of these areas caring for someone with heart disease or with asthma, they do have a potential for heat exacerbating their condition, and you want them to have air conditioning, especially the more fragile or frail their health. Talk to me about, whether it's on a policy level or an individual level, how we should be balancing those key individual needs for air conditioning, and that we want them to have that level of comfort and decreased risk with this increased demand, and how we're addressing policy.
Absolutely. Yeah, I don't want to suggest that we should, be depriving anybody of air conditioning and things like that. I think what this really speaks to is a need for understanding how our energy system responds to peak demand. As it stands now, our energy system is not really equipped to respond to the types of temperature change that we're expected to see even within the next couple of decades. And what happens on the hottest days is that we tend to fire up our dirtiest plants in areas so that we can actually provide power to everybody that needs it. And it's those plants that are the hotspots of pollution as well. So I think the part of the story is sort of managing our energy loads in a smarter way, focusing more on energy efficiency, focusing on ways to reduce unneeded electricity consumption, especially on the warmest days, and also understanding underlying population risk. We know that air pollution is a serious risk factor for health, but so is exposure to extreme heat. And so we really need a better understanding and forecasting system of air quality to understand when things are going to be especially bad, but also a better understanding of what our underlying sort of health risk factors are, especially for exposure to extreme heat. So, for example, folks that are isolated, folks that are older, are more likely to experience extreme heat events in an especially adverse way from a health perspective. And so I think, really a key is understanding the air pollution and temperature problems jointly rather than considering them as sort of unique bins in the public health world. And we're doing some work on this project, especially to think about the potential for interaction or synergistic effects between air pollution and heat exposures so that we can begin to design public health interventions that really speak to both rather than one or the other with some potential unintended consequences.
I really appreciate that answer. Thank you. Here's a question from Barb, and it's in regards to the level of attainment slide.
Yeah.
Does achieving the level of attainment actually indicate minimal or no health impacts?
That's a great question, Barb, and it's very timely given an EPA proposal from this week, in fact. So the short answer is no. When we reduce air pollution even beyond the national standards, we reap public health benefits. So we know that life expectancy is increased even when air pollution is cleaned up beyond what the standard requires. And that's evidence that's robust to any part of the country, actually. So comprehensive analyses of the entire United States over decades have shown that areas that have gone beyond the air quality standard level have actually been able to achieve gains in terms of the impact on life expectancy. So, the air quality standards are set by EPA in a process that is not entirely scientific. So it's based on hopefully the best available epidemiologic and public health evidence, but there are also other considerations made. So EPA is charged with setting the standard at a level that protects health within an adequate margin of safety. And it's really an open question of what that adequate margin is. But the short answer is that we know that there is much work to do in cleaning up our air, even beyond the current standards. For example, the World Health Organization's air quality guidelines for PM 2.5 and ozone are more strict than our EPA national standards. And so there is a wealth of evidence out there indicating that our standards actually could be stronger in terms of reducing health impacts.
Thank you so much. I just want to remind our attendees again, several of you I've tried to promote to turn on your microphone if the software is saying you have access to a microphone. So if you want to test that. If you'd like to put questions into the chat box, we have a few more minutes left here to address them. While we wait to see if there's one more question or two more questions left, Vijay, I know in a lot of the presentations I go to, they talk about the Northeast as the nation's tailpipe quite a bit because of this, the coal-fired power plants that you had put up. I did notice it seemed like around Toronto and Ottawa, there were also on some of your maps some indications that they were at risk as well. Can you talk to me about any cross-border activity or any collaboration? Because it's not as if that pollution stops at the international border.
That's a good point. Yeah, I think the role of ozone pollution in terms of international transport is increasingly on a high level in terms of the attention it's getting, especially from EPA. We know that counties in the Midwest and the Eastern United States that suffer from air pollution and are potentially out of attainment attribute at least part of their problem to pollution that is crossing international borders. The problem, of course, is regulating that pollution and understanding just what piece of it comes from other places. Some of that work has been conducted actually in California. So there's evidence that strongly suggests that a fair amount of pollution from China drifts across the ocean and into some of the areas in California that are also struggling with poor air quality. And so there's methods developed out west in terms of what's called source apportionment, basically trying to understand the chemical signature of particular pollutants and where they come from. So I do think that there is less work happening in terms of the international transport issue from Canada, though I know that EPA actually is wrestling with this in terms of a consortium of eastern states that are pointing to emissions from transboundary pollution as part of the problem. So I think this is going to be an active and contentious area into the future because it really does show that air pollution doesn't obey any international boundary.
Well, this is Jessica Kastner again. I thank you so much for this presentation. It was excellent. One of Annie's main topical areas in working groups is focus on the predicted health effects of climate change and climate change. So we're thrilled to have you present to us today. It doesn't look like we have any additional questions in the chat box, but those questions that did come were excellent. So I'm going to go ahead and stop the recording, and then we'll move on to the business part of the meeting. And Dr. Limaye, thank you again so much for this presentation.
Thank you all. Appreciate the opportunity.